I'm Harley.
Hi, I'm Jonathan. Okay, we're here today to actually introduce our specialty and pharmacy in general. Okay, maybe first question for you. What kind of role do you play at work?
I do play a lot of roles for my work though, but relating to infectious disease, well, I guess the day in, day out will be reviewing medications for patients warded in the ward itself in the hospital. And we do run clinics as well to look at our infectious disease patients. And for the patient populations that I do see often in my workplace will be mainly our HIV patients, which we do run our drug adherence clinic. Okay. How about you, Jonathan?
Okay, I do a similar role to her, and probably to elaborate a little bit more, I'm also involved in things like the antimicrobial stewardship program. So actually what we aim to do for that is to ensure that there's appropriate use of antibiotics.
So the other role that I do play at work is to really keep myself up to date to any emerging infectious diseases that is out in the horizon, because COVID-19 is just one of them. And currently, of course, the latest topic is monkeypox. And definitely dengue is the things that Singaporeans we are concerned of, because dengue can be fatal as well. So that's the other area that I do. And moving forward will be more on travel medicines as well, because the borders are opening, and definitely travel vaccines is an important area to prevent travel-related infectious diseases for travelers as well. So Jonathan, why did you choose your specialty area as an infectious disease pharmacist?
So probably first off, you want to say that infectious diseases is actually a whole variety of conditions. So it's ever changing, it's ever evolving, there's lots of things to learn. Second is actually as a pharmacist, we have a great role to play in it. It actually allows us to use a lot of our pharmacology knowledge and working together as a team to be able to apply that knowledge to make that treatment choice for the patient. How about you, Huai?
Actually, when I was a pre-reg, I am already inclined to be more upfront with the patients to be able to provide care for the patient. So I had the opportunity to work the then CDC Communicable Disease Center. And at that point of time, I am still deciding whether to choose to work in the area of infectious diseases or an area of oncology, cancer, to work with cancer patients. But during my encounter with the patient populations at CDC, I do find that it is an important area that pharmacists can contribute, especially in the management of HIV patients. So, as I get more and more involved with HIV patients, it kind of made me more interested to wanted to go into infectious diseases, and help them.
What is your most favorite aspect of your job?
Favorite aspect of the job? Well, like what Jonathan has mentioned, working as a team, we do have a multidisciplinary team, which we don't only work with our own pharmacist colleagues, but we work very closely with our doctors, so medical social workers, nurses, and even other allied health professionals as well, like dietitians, physiotherapists, and occupational therapists. So the team spirit is really there, because we all have the same goal and missions to take care of the patients and ensure that patients really recover well. And also because of the clinics that I run, we really have good rapport with our patients. So seeing some of my patients that are really, really very sick and recovered well and able to bring smile to you when they come to my clinic, so that's my most favorable aspect of my job as well.
Actually,
how about you?
Actually, I echo what Hua Ling said. So the two parts, one is working with the people that you interact with, the team that you are, and the more important thing, of course, is, as she mentioned, seeing the patients get better. In fact, we don't only see them that they are acutely better, but we see them such that we are taking care of them for years and years and years. It's not just saying them goodbye when they discharge, but also getting to know them and being able to work together with them to maintain a healthy lifestyle.
How about any interesting stories or other challenges that you had with any of your patients?
So just an example, a patient who actually was quite ill with multiple infections due to immunodeficiency, that means the immune system wasn't working so well. So at the initial state when the person was newly diagnosed, there's a lot of fear, there's a lot of mistrust. So there will be a lot of questions about why certain things need to be done, why tests need to be given, why does the person need to take a lot of medications. But it really takes time and building of trust that we think of ways to allow the person to take the medication better. Eventually he accepted and I think is on the road towards recovery. And the most thankful thing is actually he maintains a positive attitude. How about yourself, I think?
I mean, definitely there are a lot of interesting stories, but I guess if it's revolving around medications, it's really a lot of how patients overcome their fear of taking medications. And how we help them to overcome that fear. In a way, when we talk to them, we will also understand why they may not want to take the medications, and there could be other issues that they raise, and we could actually help them to resolve it. Oh, how about this? How do you think your job can empower a healthier you? To really educate them not to anyhow take antibiotics. Because not a simple itchy throat you need antibiotics, or a sneeze you need antibiotics. Okay, if it's a viral infection, doesn't need antibiotics.
Yeah, so this is a important message we want to get out from the antibiotics leadership too. And it's also a message sent out nationally. Don't take antibiotics for viral infections. Usually your cough and cold is all related to viruses. COVID-19 is related to a virus. Antibiotics do not help you get better. They also do not help you get better faster. So we rather save antibiotics for when it's needed to be done, because otherwise there's less and less effective ones that you can use, and it's going to get harder and harder to treat even simple infections like a urinary tract infections or a throat infection. Then Hua Ling was also talking about
vaccination. Yes, immunization prevention is better than cure. So elderly patients should go for your annual flu vaccines. And of course, for those with chronic diseases, your pneumococcal vaccination is very important as well to protect you from what we call pneumonia, which is lung infection.
Yeah, so vaccinations is an important part, like the two vaccines that Hua Ling mentioned. There are also others, including things like your hepatitis B, chickenpox vaccines. So there's a whole range that can be taken for and recommended. So based on the conditions and based on the risk factors, the pharmacist can also help to make that recommendations on which are suitable and where you can actually get these vaccinations to be done.